I'm Peter Block, and it is day 3 here in Chicago at the AHA annual meeting. I'm here for On the Scene. With me is Deepak Bhatt, and we are reviewing the hot trials of the day, what's really interesting. And it turns out day 3 was sort of a little bit of a void, but there is one major trial that we have to talk about, Deepak. I'm going to go back in the history a little bit. Back at ACC last year, the surgeons presented a critical trial: does mitral valve repair trump mitral valve replacement? The old mantra being mitral valve replacement was not a good operation, mitral valve repair is a great operation. Turns out no difference between those two groups, although the way that was presented is a little bit controversial because all the answers are not in on that one. But in general, probably no difference. Now we have a more interesting trial, for me anyway, and that is, what about moderate mitral regurgitation? Should surgeons who are doing coronary bypass graft surgery deal with moderate mitral regurgitation or not? What do you think about this trial, Deepak?
Well, intuitively, a lot of surgeons would say, look, I'm in there in the chest anyway. Yes, it makes the surgery a little bit more complex, a little bit more time on the pump, but why not do it? And that's a very prevalent practice at many centers. What this study did was randomize patients who are receiving CABG to either have the moderate MR addressed surgically or not. And as it turned out, the primary endpoint, it was a mechanistic study. To do a clinical endpoint study would have been an enormous trial. So it was a mechanistic study, didn't show any difference at 1 year in the left ventricular end systolic index. So at that time frame, no difference.
Yeah, it's a funny trial though, and I think perhaps premature to throw the baby out with the bathwater here. It's really a 1 to 2 year trial. They're still looking at the outcomes. And remember, this is moderate mitral regurgitation. And even the Everest trials, the MitralClip trials, have an indicator that if you reduce mitral regurgitation to less than 2+, outcomes may be pretty good just in terms of how patients fare.
Well, I agree with you. 1 year may not be long enough to see an effect on the LV from reducing moderate MR. But on the other hand, there was a signal of more neurological events, low in frequency, but still higher in the patients that were, I guess, on the pump longer because of the MR surgery being thrown in.
Well, I would expect it as well because you're in the left atrium, right? And therefore, there's going to be some neurological events that occur. The pump run, of course, is not always good for your brain. So I think the jury is still out on this one. I would like to see this go out maybe 5 or 6 years. I doubt that they will follow that long, but perhaps they will. And if so, we may learn about moderate mitral regurgitation and what that does to the left ventricle, and whether or not repairing that may not make LV end systolic index better if you repair it.
Yeah, it's a common situation that comes up in patients getting CABG, so I think it's important. And also has implications for what we might do in the cath lab in the future in terms of percutaneously addressing different degrees of mitral regurgitation.
I totally agree. That whole issue of moderate to severe mitral regurgitation is a funny, murky area. We need to learn a lot.
We do.
Okay, thanks, Deepak.
Thank you.